Good evening. I'm Dr. Ed Weiner, and with me this evening, here present, is Gail DeMore, member of the Board of Health. Remote, we have Vice Chair David McSweeney and Andrea Sheehan, and Mary Beth Welch could not be with us this evening. Also here is Susan Luminello, Director of Public Health, Michael Green, our Associate Director of Public Health, Environmental Engineer Christine Mathis, and our Recording Secretary, Ms. Julie Falkingham. I want to explain, this is sort of a strange meeting this evening.
Excuse me.
According to Massachusetts law, and I checked with our town clerk, Amy Warfield, as well as checked by our Director of Public Health, Susan Luminello, we are allowed under the law of remote meetings up until 2025 to have a hybrid meeting of this type. So there are two of us here this evening and two people who are remote. Please note that we're also live on and taped by BCAT and available for appropriate comments and questions through this video technology. And thank you for BCAT for doing what you do for this community, keeping us all aware and so well informed. I always put that in because that is a requirement for remote meetings, that we let everyone know that it's being taped and it is live on BCAT. Which brings us to approval of minutes this evening, and we do not have any. Citizens' time. We don't have anybody here in the building. Is there anybody online who would like to speak about, who are not on the agenda, would like to speak to the board?
No, no one else on.
No one else is on. We're all set with that. As usual, I have put together a chairman's report. We'll soon be entering November. That means it will soon get cold, slippery, icy, and maybe a lot of snow. Hopefully not too much snow. Many of these come with, and sometimes, major situations. Although the town and the Board of Health may be able to help in some cases during these situations, it's also a good idea to get ready for winter and develop an emergency preparedness plan. I urge you to take a look at the Board of Health website. We propose, under resources, what you should consider to have around during winter. Sometimes there are emergencies during a snowstorm. The list is quite obvious, like flashlights, batteries, food, water. Take a look at the obvious. But also take a look of the not so obvious. It's another big list. Lots of things that you should think about having, like prescription and non-prescription medications, personal hygiene products, warm clothes and blankets. Even what I forgot, having reading materials for the whole family in case you lose electricity or, God forbid, the internet, you have something to do. And don't forget pet food and what else you may need for your non-human friends. The Board of Health has also some publications. We have some available. Just swing by the office, stay away and be prepared. We also have a very good one called Disaster Preparations for Seniors, by seniors. And don't forget, you can always call 911 for emergencies. And of course, the Burlington Board of Health phone number is 270-1955, 781-270-1955. We always may be able to help. Let me also just move on to something else which I think is important. Many of you know that we have an outstanding administrative assistant by Sarah Quartermash. Many of you know her. I have spoken to her, and she has said it was okay to talk about the fact that she is out on maternity leave, and we just heard that she had a baby girl named Avery Lee. Congratulations to Sarah Quartermash and her husband Andrew for a beautiful baby girl. Thank you. Subcommittee reports. October 11th, 2023. Two members of the subcommittee, which either of you would like to give the subcommittee report. It can be very short and sweet, but we need a report, and we don't have to vote on it. So,
I'm happy to do that.
please.
Andrea Sheehan and I met with Susan Luminello, and we went through the applicants that had applied, kind of ranked the applicants, and we also just discussed the difference between the job description and the posting
For
the supervisory nurse position. And we just kind of came up with a list of what we're considering essential qualifications. We did meet with one person, and I think we're meeting with another person tomorrow.
Thank you. Andrea, is there anything you'd like to add, or is?
No, that was perfect. Thank you, Ed.
Thank you so much.
You're welcome.
Really appreciate it. And again, we do not have to vote on that. I appreciate that very much. Takes us to staff reports. The environmental engineer, Christine Mathis. Do you have anything before we ask a bunch of questions? Because I got a bunch.
Okay, good. Yeah, just an update on mosquito control. Sampling, trapping, and testing of mosquitoes is done for the season. It wrapped up last week. There were a total of 5 West Nile virus cases in the state and 0 EEE. Mosquitoes are still pose a threat, although the colder nights, slow them down a bit, but they are a threat until the first hard frost hits, and that is defined as 4 hours below 28 degrees Fahrenheit. So we haven't hit that yet in most parts of Massachusetts, except for maybe the elevated areas out in the western Mass.
So I'll go through the list now. David McSweeney, do you have any questions for an environmental engineer?
No, I think, just I guess a comment, nothing to do with the staff report. Bricksmore property about a week or so ago. And it doesn't seem like I don't know if any of you drove by, I don't know if Christine or Susan, if you had a chance to drive by the property, but it doesn't seem like the cleaning of the basin did anything at all. In fact, it looks probably maybe a little bit worse. It wasn't pretty dry out when I was there. So again, just a comment. I know we have them coming back potentially sometime in April. Is that correct? But if there's any communication before then to start thinking about what the next steps are with that, or if we need to have conversation internally about what we think the next steps are there with them. Just want to put that up as on the record.
Thank you very much. Andrew, do you have any questions for the environmental engineer?
No, I do not.
Gail Demora, do you have
did
any?
not.
I've got a couple. First, congratulations, you finished your annual hazardous material inspection for this year. Congratulations.
I got about 4 left, but
You got 4 left? I thought you were almost done.
Oh, no, it's not
4 left. How many are there in total?
80 plus.
80 plus. Well, it's a lot of work, and thank you.
Yeah, sure.
Fox Hill School installation of septic system. I didn't think we had too many septic systems in town, and now we're installing one. Is that?
No, there was a question that I guess the engineers or consultants who are working on Fox Hill School asked about if there was an option to install a septic system versus connecting to sewer. But if sewer is available under Title V, you have to jump through a lot of hoops to be able to install a septic system. You have to prove a hardship, or you have to get approval, an exemption and approval from DEP first, and then I believe you have to also get a approval from this board. So when I asked why, of the DPW staff that contacted me about it, when I asked why they were even asking about that, when, I mean, they're on sewer right now, why would they want to install septic? I guess they were looking at a water neutral status or something, and septic is more favorable in that case. I don't know that much about that aspect of it, but they'd have to go through a lot to put one in over there.
Yes, thank you.
Okay.
It's Independence Park versus the town of Barnstable. Some of those things that came through that lawsuit many, many years
Yeah.
ago. And then that last question has to do with shops, medication disposal no longer at the police department. Can you have anything you can tell us to update? I know you're looking into some of that. If you need me to put this off until next meeting, I certainly understand. But if you have anything, because I am getting some questions about that.
So the current status is unused or expired medications can be taken to several places in town, including Leahy in the lobby next to their pharmacy, and at Osco, at the Osco Pharmacy in Shaw's, and to CVS at 242 Cambridge Street, and both, I believe all three places, I know the two retail places, Osco and CVS, you can only bring them during pharmacy hours. I don't know what Leahy's hours are for their turn-in medication facility. Right now, the kiosk for Sharps is, we still have the one at the fire department. There aren't any commercial locations or retail locations where there's one available in town. But I'm looking at a more frequent pickup at the fire department and working with Susan to figure out how we keep them running.
Do we know why the police department stopped taking?
I do not.
You know, okay. I have no other questions. Last call. If not, could I please have a motion to approve the environmental engineer's report?
So moved.
I have a motion by Ms. Demore, second by Ms. Sheehan. Now I got to do a roll call. I'll say all in favor. Mr. McSweeney?
Aye.
Ms. Sheehan?
Aye.
Ms. Demore?
Aye.
And I vote aye, 4-0-0. Okay, which takes us to the Associate Director of Public Health. Do we have any questions for Mr. Green? I'll go through this. Mr. McSweeney, do you have any questions?
I don't, Mr. Chair, thank you.
Ms. Sheehan?
No, I don't either.
Yeah, I have a few. CarFit, how did it go?
It went well. It was,
Maybe explain what it is, please.
yep, CARFIT is a program developed by AARP, AAA, in conjunction with, I think it was the University of Maine. And basically, as we get older, we change a little bit, and to adapt the car to us so we drive it more safely, they developed CARFIT. It's a 12-step inspection process, and if there's any changes, we can assist with, making them adjust the car to them. We do that, and we also bring on occupational therapists. And so if there's additional changes they might need, if they're having difficulty getting in and out of the car, fitting other aspects to it, if they're rather short, they might need a seat cushion, different stuff like that. So the OTs provide assistance in that regard. We only had 2 participants, which was kind of low in number, but we did do a bunch of practice amongst ourselves just to, make maintain the technician skills. But of the two that we did, I would say we had a profound effect on their driving experience. One of them was actually at the COA Health Fair today and commented to one of our trainers, Jackie, that it really made a huge difference in her driving. She's a lot better now. So that's a good program. We're still looking for some occupational therapists that we can bring on to the BBRC so that we can run that program kind of in-house with the COA participants.
Next question. Tomorrow evening is a very unique program that the Board of Health is offering through the Reserve Corps. Maybe Chuck, a little bit about that?
Yes, we have Ed Edden with Wright. He's going to be conducting some trauma inclusion training. He's going to go over the different types of trauma, how we internalize that trauma, and if you're dealing with someone going through trauma or you yourself are going through trauma, he's covering kind of the concept of the window of tolerance. So that should be a good training. I believe that's from 5 to 7. Hard stop at 7 because I think he has something going on after that. But I think we do have time for a question and answer.
And he has spoken at least 2 or 3 other times, and he's very good. So I urge you, if you have some time tomorrow between 5 and 7, he's a very good speaker and very informative. And last, I want to acknowledge you for you're in a program at Suffolk University on leadership, and I just want to acknowledge that. Thank you very much for taking that into consideration, for doing that for your position and for the town and for the board. We thank you.
I certainly appreciate the opportunity.
Do you go into class, or is it
Yes.
online?
The class is actually at the Danvers Police Department.
Oh, okay, cool.
So we have different trainers coming through. There's 5 different sections. We're in the second portion of it now, covering legal aspects in the morning and then public safety in the afternoon. We just finished the leadership course, and I know Susan's gone through it. A bunch of folks in town. It's really a fantastic course.
Anybody else? Last call?
No, sorry.
Okay. Do I have a motion to approve the Associate Director of Public Health?
So moved.
I have a motion by Mr. Maury, second by?
Second.
We'll take the second this time from Mr. McSweeney. Again, all in favor? Mr. McSweeney?
Aye.
Ms. Sheehan?
Aye.
Mr. Maury?
Aye.
And I vote aye, 400. Thank you very much. So now we go to the Director of Public Health, Susan Luminello. And her report includes the health agent's report and the associate health inspector's report. So what we've done in the past is we all have Marlene Johnson, our health agent's report. Are there any questions? Are there any questions concerning that? I'll go
Just
to,
one, Mr. Chair? I'm sorry.
please, Mr. McSweeney.
Yeah. And Susan, if you don't know the answer to this, I can.
So at the next meeting, but there seems to be, or had been a lot of changes to the HACCP plans for sushi rice. Was there a change in how we monitor that or something, that they had to update their HACCP plans? Do you know offhand? There was like 3 or 4 of them that had to update them.
I don't know what the change was for that or why they were being updated.
Preserving the rice with vinegar?
Yeah, well,
Well, that's what, yeah.
standard, that's the standard.
Oh,
Yeah, but I don't know what the changes were, or if there were changes, or they were just needed to update their plans. It could be that she was doing them and they needed to be updated.
Yeah, that's fine. I can ask her the next time. I was just curious. There happened to be 4, I think, that had to update their HACCP plans. So I was curious what the changes were.
Okay.
Okay. Ms. Sheehan, do you have any questions?
All set, Ed. Thank you.
Mr. Maury? I had just one. She had a reference to the... So far, we're all set there. Is that correct?
Yes, they've been doing, they've got the food consultant in, and they've been doing, they're sending us the reports as required, and doing a good job, so no issues there.
There was also a reference to non-criminal fines that we give, fines. Do we have any idea around, and we can look this up maybe for next time, about how much of these, what do we collect? About how much do we collect a year for non-criminal disposition fines?
I don't know that. I guess that's something we'd have to go to the clerk's office for.
Okay.
You know, a non-criminal fine is a $50 fine, and, you know, we give out quite a few, so.
Okay. Which now takes us to the Associate Health Inspector's report, which is Samantha Hardy. We'll start off, Mr. McSweeney, do you have any questions?
No, Mr. Chair.
Ms. Sheehan?
No, Mr. Chair, thank you.
I did not.
I just had a question about the keeping of ducks. Did you see that?
Yes, so that was a complaint that came in, keeping of animals. We did do an investigation, we did talk to the person, and through questioning and how they were keeping them, it was determined that they were pets and they would not fall under our regulation.
Oh, so let's take that a step further. We had a question from Mr. Maury, we were talking, that she asked you earlier. What about pets and regulations?
Yeah, so our regulations do not cover household pets. So if you consider an animal like a duck to be a household pet, then it would not fall underneath our regulations.
And reptiles?
Reptiles and cats and dogs.
Reptiles, cats.
Although the clerk's office does have a kennel permit license
Okay.
for the keeping of, I think it's 4 more dogs.
It's dogs.
That's not our licensing, that's the town clerk's office.
Okay.
Okay.
We assist them and give a recommendation for those, but we don't give out permits.
Okay.
Thank you. Which now takes us to the Director of Public Health's report, Susan Luminello. We'll go back again. Mr. McSweeney, you have any questions for Susan?
Just curious on, and I'm sure we'll talk about this anyways, about the flu clinic and getting an update and how successful it was, all that.
Yeah, so we have now, we've done several smaller clinics. We did for the high dose, we did it for regular dose. We've done a larger type of clinic at Grandview Farm where we gave probably about 250 doses in that day, which isn't as much as we normally give, but we had the other clinics prior to, so we've given out all the high dose, which is good, so we have no more high dose left. We have about, I think it's around 300 doses or so of the regular dose, so we're going to be at the Employee Benefits Fair tomorrow to give out vaccine. We're also going to have another clinic for the public next Wednesday, November 1st from 3 to 5. People can sign up, go to our website and sign up to get a vaccine for that clinic. And then that should be the last of our flu clinics. We'll have given at that point most of our vaccine out.
So it seems like it seems like we've given out
About the same amount that we normally give out. It looks like the levels have still maintained pretty high.
Yeah, and we ordered less high dose this year because last year we just couldn't give it all out. We ended up having extra high dose, but this year I think we ordered the right amount because we gave it all out, so that was good. So we were able to give all that out. And the event at the Grandview Farm, I got many comments from people about how easy it was with the parking, coming in and out, and it worked really well. I really liked using that facility. I think next year maybe we could do maybe a separate one, a high dose one at the Grandview and then maybe a regular dose at the Grandview because it did work out really well.
That was by appointment only too, right? And it still worked out pretty good.
Yeah. So the appointment only, I mean, there was some people who came in and we just signed them up, but the
Yeah,
appointment only works really well. And we, now that we're able to do that, we can kind of plan for, how many people are going to be showing up. So.
Yeah, that's what I liked about it.
Yeah.
It's awesome. Cool, thank you, appreciate it.
Ms. Sheehan, anything?
I'm good, thank you.
I'm okay, thank you.
I have two things. First, just want to acknowledge that our Director of Public Health did give a lecture at University of Massachusetts at Lowell. Some other very famous person gave a talk there also recently from the town. And please update us with what's your program on the Burlington schools, the vaccination program. I know that is a huge undertaking.
Yeah, and I did want to bring that up because I wanted to thank, all the people that were involved in that. So it's still ongoing, but last week we gave out 151 immunizations to 38 students. And it was a large effort with a lot of people involved. The Board of Health staff and volunteers, we had admins involved, so we had Jen Goulet, Sarah Portamage, Katie Capobianco in our office who did scribing. We had the nurses, we had Chris Pollock, we had Rashad in our office, we had several Medical Reserve Corps nurses who came and helped out. We had Taisha serve as a translator on each of those days. And then the school staff also assisted. So we had the two translators from the schools. We had the school nurses, Rosie Pascal and Susan Shields and Barbara Conley, who do such a great job. And then they also had assistants there, Jessica Roy and Caitlin Gilbert, who helped get the students out of their classes. So it was just a huge team effort, and it took time to kind of set it up, and it was a team effort setting it up, and it was a team effort doing it, and everything went so smoothly. I was really happy with the way it went, and it was really good. So we're going to continue it because there's still a lot of these students have to get, 7 vaccines, 6, 7 vaccines, and we didn't want to give them, 5 vaccines, any more than 5 in one day. So we're doing another one, a second one at the high school so they can finish them off. That's going to be in December 1st. And then we also have middle school and elementary school students who need vaccinations. So we're going to start working on those in November. So we have one scheduled for November 13th and one for November 20th. So a little bit less at that level, but I think we probably have about 30 or so, maybe elementary and middle school students who need vaccinations. So that's our next thing to work on.
Is that harder to coordinate because it's between different locations?
Yeah, well, the high school was good because, we were able to, we went there. So we're going to try to do it the same way, but the problem that we're running into is they just don't have a room big enough like they have at the high school, because we had 3 vaccinators, 3 scribes, 3, an admin, a translator, like all in the same, and 2 additional nurses who were drawing up vaccine and diluting the vaccine. So we had a lot of people in one room. So we're running into that problem where we're trying to find a room big enough where we won't be there like all day long. We're trying to, we were able to do these, and we had 5 nurses, and we did it about 3 hours.
Wow.
So 3 times.
Right.
Yeah.
These are new citizens, these are new people to Massachusetts. These are children, and this board is prioritized to children, and we will do whatever we can to ensure the safety and the health of kids in this community. I know I've said that many times. I know that everyone here believes that, and as long as that is, thank you for everything that all of these people are doing. These are the kids in our community, and we will keep them healthy no matter what. Thank you.
Yeah, and I also want to thank Barbara Conley, who's the lead nurse. She's been, just diligent in giving us the records, and she helped vaccinate on each one of the days. So it was a big help. And one other thing, just the Vaccine for Children program, which is what the Board of Health has been doing for years, is for uninsured and underinsured children. Mm-hmm. So it's not just if you're uninsured. So if you if you have Mass Health Limited, that does not pay for vaccines or physicals, so you do not.
That's an out-of-pocket cost, right?
You have that as well, yeah.
We will, and again, we will ensure the safety and health of kids in our community. And I think that's that's a priority, one of our number one priorities. Thank you for that. Is there anything that I missed that you would like to tell the board about?
Not anything that I can think of. We've been kind of immersed, I think, in this vaccine, or I have, and a lot of the staff has as well, in this vaccination effort. So that's really kind of what's been going on in the flu clinics, of course, which is kind of winding down. So, yeah, I can't think of anything else.
Now, I saw that you sent this report to the superintendent, and you sent it, I think you copied us on this also, but I think somebody should send it to the school committee because they need to know that we are working in lockstep with them. So please send it on to the school committee.
I did send it to Martha Simon.
You did?
Oh, good.
Yeah, and this will be, and I copied you on it as well, but I didn't copy the whole book, but it'll be in my next board report.
Please put it in the next board report because I think it's so important and it's really to the heart of what we do in this community and what this board is always stands for. If there are no other questions, last call. I'll ask for a motion to approve the Director of Public Health report, Susan Luminella. Do I have a motion by Mr. Maury, second by?
Second.
Second by Ms. Sheehan. All in favor?
Aye.
Well, I gotta go through the roll call. I'm sorry. Mr. McSweeney?
Aye.
Ms. Sheehan?
Aye.
Mr. Maury?
Aye.
And I vote aye, that's 4-0-0. Before I ask for a motion to adjourn, we have a quick evening. First, I want to note that I have always felt strongly that we will not skip 2 meetings with no major agenda items. We will only do 1 meeting, and that's why we're here this evening, in case there were people in the community who wanted to ask this board question or to note something. And second, it's always nice to see everybody for continuity, and thank you all for coming. I know that it's very hard to get here sometimes, but we do have a hybrid meeting, although remote. So, in closing, get your flu shot. We heard when flu shots are available through the town. Consider the new COVID vaccine. I'm just going to say that, consider. And as our former chairman of the Board of Health, Dr. Wayne Salzman, used to say, number 1 priority is wash your hands. And with that, do I have a motion to adjourn?
Motion.
Motion by Mr. Maury, second by?
Second.
Second by Mr. McSweeney. All in favor? We'll go through it one more time and last time. Mr. McSweeney?
Aye.
Ms. Sheehan?
Aye.
Mr. Maury?
Aye.
And I vote aye. Good night, everybody. Be safe, and we'll see you in a couple of weeks.